spoke to Dr. Glenda DeMoss. She is a health psychologist, and she said that patients and their families, they really need that support. That is something that's so very important, because you got to remember, these are people that have waited months or even years for that life-saving organ, and now they're being told that it's not going to happen. So she actually shared with me some tips about counseling services and what you should look out for if your loved one is starting this very difficult journey.
I would highly recommend group therapy for any family that has been faced with this challenge. In order to matriculate through such a challenging time, it would be great to have a system of support. And that's other families that have experienced the exact same, just to see how they're coping through this. Now, if you see that your loved one is, feeling a little bit more isolated, having suicidal ideations, you want to immediately get them in with a trusted mental health professional so that they can provide them with that psychological support.
And Dr. DeMoss says that patients and their families are not alone. She spoke to me about a story that she saw on our newscast about a woman who had to wait 6 years for an organ, only to be told that it's not going to happen. She said the psychological aspect of someone being told that they need a kidney or a liver, and then having to get on a list, and then all of the paperwork and everything they have to go through, can be very stressful.
This isn't something that they just sign their name on a list and say, okay, you're a great candidate, let's move forward. No, they have to go through an immense amount of preparation to even be considered as a candidate. Stress tests. They do a lot of blood work, a lot of doctor visits that they have to go to on a consistent basis, making sure that they check in. They have to make sure that every other area of their health remains at the state that it needs to be at, so that their body can receive this new organ that they're about to, have. So it's not.
So that support is so very important during this difficult time. And Dr. DeMoss says she is happy to help any families or patients that need it. You can find her information on our website at clicktohouston.com.